Hi, my name is Dr. Adams, and I'm a dentist at Serene Holistic Orthodontics, and I deal with a lot of patients who have sleep apnea and TMJ pain. And today we're going to talk about a few ways where you can improve your airway. You can probably get rid of a lot of like jaw and TMJ pain, and you may even be able to cure yourself naturally of airway resistance and sleep apnea. So the first thing I'm going to do is just talk about a few things that impact the airway so we can begin to get an idea of where the problems can occur. So the first thing we're going to do is we're going to talk about nose breathing versus mouth breathing. And long story short, the airway actually starts with your nose. So you breathe in through your nose and it kind of goes down the back of your throat and into your lungs. And you can think of that kind of like the main pathway for air to flow from this space out here into your lungs. And the airway, you can almost think of it kind of like a floppy hose, this airway that's down here. So, there's a lot of muscle tissue that lines the airway. And as people get older, it can get a little saggy and flabby, and it can collapse. So that's really the whole issue with sleep apnea is airway collapse. And sometimes the problems can lie in the actual airway itself, which is the pipe here, or more often than not, the airway, the problems with the airway lie between the upper airway, which really you can simply define as like your nose and your mouth, which is like the part of the it's kind of like the entrance of the airway. If you've got like a funnel and you got air that can come through the funnel and then it finally gets into the main part of the funnel and it goes on down and into the lungs. So anyway, so if you think about it logically, you have air that can flow through your nose, and as air flows through a kind of a floppy hose, it'll kind of blow the airway up. So that is, what I'll normally tell people. If you're kind of breathing properly through your nose, it's going to inflate your airway. And then when you start breathing through your mouth, that's when bad stuff happens. So if you're breathing through your nose and you're breathing through your mouth, you can think of it like you have like one hose kind of meeting up with another hose, and where the mouth and the nose air meet, it's going to be a pressure differential, and it's going to start flopping around, and it's going to act to close the airway down. So I'll normally tell people, if you want to really oversimplify, if you're breathing through your nose, that air is going to more or less act to inflate the airway, and the second you start breathing through your mouth, that air flow is going to act to collapse your airway. And there's a lot of other bad things that can happen when you're breathing through your mouth as well. There's tonsils, there's like a tongue, there's adenoid tissue, there's soft palatal tissue. And when you pass air through your mouth, you can kind of begin to like suck that flabby, saggy tissue into your throat, and that's when bad stuff happens. So there is a certain dynamic where it's much more advantageous to breathe through your nose and breathe through your mouth, and a lot of it's just like physics and airflow dynamics, and we certainly have to pay attention to that dynamic if we're going to try to prevent our airways from collapsing at nighttime. The second issue is muscle tone and muscle strength. There's two primary muscle items in the airway. There's, if you really want to oversimplify, there's muscle tissue that kind of lines the airway and forms kind of the backbone, that floppy hose, if you will. And then there's the tongue, which is an extremely strong, large muscle that certainly represents the largest moving part in the mouth. And there's no doubt that if you have a weak, saggy, flabby tongue that doesn't stay where it's supposed to be, which is up in the palate, and it's hanging out and flopping back into the back of the throat, it can get in the way and literally obstruct the airway. So if there's certain exercises that we can do that we can get more into later that'll strengthen the tongue, get it a little bit stronger, get it to be a little less saggy and flabby. And there's also exercises that we can do to strengthen the muscle tissue that lines the throat to get that backbone of the hose to be stronger, and certainly tissue that is stronger and tighter and tauter, that postures properly, is going to be a lot less likely to collapse. So, that's why I just wanted to bring the muscle tone and the strength of the muscle issue to your attention. The next thing we're going to do is we're going to get into volume of space. And in the airway, we're talking about the volume of the mouth and the actual volume of space available to get airflow through the nose. A lot of people have like deviated septums, they get a little stuffy and huffy in their nose, and if you have like a really high vaulted small palate, that palate, and it's actually the base of your nose, if it's kind of tiny, there's no surprise that when you go to breathe into your nose, if there's not physically enough room to get the air that you need through your nose, and we already know that airflow actually inflates your airway. The next thing you're going to do is, if you can't get enough air through your nose, you're going to open your mouth. It's a much bigger hole. You can get more air through there, but the airflow dynamics of breathing through the mouth is not nearly as good as breathing through your nose. So volume of the mouth can be another thing. We're talking about volume of the nose. Let's talk about volume of the mouth. First thing, we think about the width of the mouth, that space available between the teeth for the tongue to physically fit. If the mouth isn't that wide, and it's not, let's think about the width. If your mouth isn't really that wide, your tongue more or less, the biggest moving part in there, the tongue more or less is going to be squished. And when people go from light sleep into deep sleep, all the muscle tissue in your body, including the tongue and the soft tissue that lines your airway, is going to relax. And if that tongue doesn't really fit too great in your mouth, it's going to go where it better fits, which is further back in your throat. So, enough width of space for your tongue to physically fit in there can really be a real big problem. The next thing is the actual forward dimension of your jaw structure. When you're younger, your jaw structure should grow out a little bit. And when jaw structure grows out, it gets a little taller, and that height is a really big deal, because if there's more like height, thanks to, there's more height, there's more width, there's more volume. A volume of a space is much more important than a two-dimensional increment. The other thing that's a really big deal is as the height of the mouth gets greater, that actually stretches the muscle tissue out. And the height impacts, between your lower jaw and your upper jaw. And actually between your lower jaw and there's this bone down here that sits halfway between your neck and your shoulders called the hyoid bone. And when the jaw structure, and there's muscle that goes from here to here, and here to here. Us anatomy people, we actually call them the supra, or the muscles that are above the hyoid bone, and the infra, the muscles that are below the hyoid bone. So if this jaw structure gets taller, muscles in response to height of bone, they can get more stretched out. So muscles are very picky about the height and the length that they work under. So if muscles are sitting up a little taller, they're going to be extended. If muscles are sitting too low, they're going to be compressed. And it's kind of like a spring. You compress a spring, it gets a little flabby and saggy because you've compressed it. And if you lift them up, they're going to extend. And there's this sweet spot where the muscles get just to the right working length, kind of like a spring, where they're happy. They're not low and saggy. They're not too high and hyper, stretched out. And the impact here is that, getting back to the hose analogy, if the muscles that are here in this throat are too low because the volume of space in the mouth just didn't grow to be big enough when you were a kid, these muscles are going to be kind of like a rubber band that's not even stretched at all. It's just going to have all this slack, and there's going to be a lot of extra tissue in here, and it's going to be much easier for the for the airway to collapse. That hose is going to be much more sag and much more flab right off the bat. So these issues are really really big deals, and all these three things that I just mentioned are huge opportunities to improve airway performance. If you just want to give up and buy yourself a CPAP and have some stupid machine like blow air down your throat for the rest of your life, you don't have to worry about this stuff. But that would be like, if your leg muscles are kind of weak because you broke your leg, and you could just have somebody push you around a wheelchair for the rest of your life too, and that's just no way to live, and your leg muscles are just going to turn to complete mush. So, and that's pretty much what happens if you just give up and you're just like, screw all this stuff in my airway. I'm gonna have this dumb machine blow air down my throat for the rest of my life. That tissue is just going to get used to this thing blowing air down your throat and inflating your airway and pushing air down into your lungs, and it's going to do it for you rather than you do it yourself. And your airway muscle tissue is just gonna turn to mush. Let's talk about a fourth thing. Fourth thing is tongue posture. As I mentioned before, the tongue is a large moving part in the mouth, and tongues. Just to give you a little bit of education about tongues are supposed to be able to fit up in the palate. It should lift up and sit up in the middle of the palate like a suction cup, and literally just like a suction cup will suction onto a window pane or something like that. Your tongue, if you were to do a tongue check when you're not doing anything, you're not talking, maybe you're reading, and you just do a tongue check, your tongue actually should be resting in your palate, and it'll stay sort of suctioned up in there. And if it's staying in your palate, it's not going to be dropping down into the lower part of your mouth and flopping back into your throat. So that's how we control the tongue the tongue obstructing the airway. And that's also where that term, most time you don't just, people abbreviate sleep apnea, but technically most sleep apneas are obstructive sleep apneas. It's because there's something literally obstructing the airway. It might be the tongue flopping and blocking the airway, which is probably 90% of the time what's going on with most people who have sleep apnea. It could be that the airway itself is kind of collapsing because the muscle tissue that lines the airway is kind of weak, and it's just collapsing. But keeping that tongue on the roof of the mouth, and keeping it posturing where it's supposed to be, goes a long way to preventing collapse and obstruction of the airway. And the final thing I'm going to talk about is CPAP. That's sadly a lot of times what people get stuck in. They'll go to the sleep doctor and they're like, oh yeah, we're going to give you this sleep test, and here's sleep here, and they hook all this stuff up to you, and you get this report later like, hey, you stopped breathing 30 times, and your blood pressure got high, and your oxygen level got low, and here's this machine, put this on your face and wear this thing for the rest of your life. I mean, that is now actually I'm not poo-pooing that, that's something that somebody shouldn't do at all. If somebody has a really bad sleep apnea condition and not getting any oxygen, and they're having all these things, well, by all means, you may get stuck using this thing until you can do all the things that I was talking about. You can try to do things to, make it so you breathe through your nose instead of your mouth. You can try to do things to improve the muscle tone and strength of your tongue and the tissue that lines your airway. I actually have these appliances that I use in my office a lot. They're called expanders, and what they do, and we have them for adults too. What they'll do is they'll literally stimulate your mouth to grow a little bit wider and a little bit more forward, and they'll improve the volume of space in your mouth and your nasal passageways, so you can breathe through your nose, and it creates more space so your tongue can actually fit on your palate. We'll give you tongue exercises to do to strengthen your tongue, and some people have tongue ties that need to be untied so the tongue can actually elevate and stay in the palate. There's little devices that look like that you can kind of blow into, kind of like if you blow up a balloon. It's like, really hard sometimes if you're really trying to blow up a tough to blow up balloon. That'll really strengthen these muscles that line your airway, and you can improve the strength of the muscle tissue that lines the airway to get that floppy hose to have a bit more backbone. A lot of us could maybe stand to lose like 5, 10, 20, 50, 100 pounds, and reducing the fat, if you're going to lose that kind of weight, you're probably going to get into better shape. So we can't neglect that. But anyway, I think you get the idea. This is just one of many videos I have. Just to give you a little bit of context. Again, I'm a dentist, so I see a lot of people that have sleep apnea, and they're hoping that we'll cure their sleep apnea with appliances, but there's a lot of airway dynamics and tongue function, muscle tongue function. The appliances will get the structure to be a better size and shape, but there's a lot more to it. The other thing that I also do is I have a license in dental anesthesia. So we put people to sleep with IVs, and we do some surgeries, and anesthesia people, for anybody that knows anything about anesthesia, you learn a lot about the dynamics of the airway. So that's just sort of the angle that I come at this. It's an anesthesia person and a dental person, and specifically a dental person who treats a lot of sleep apnea and TMJ. That's where we get to the place where we're talking about this kind of stuff. But anyway, my name is Dr. Adams, and I hope you learned something from this, from Serene Holistic Orthodontics, and have a nice day.